Thank you, Brian. Tonight, health officials want to ease concerns about Ebola after a new outbreak overseas. Kayla Johnson joins us from the newsroom. Kayla.
Lizzie, the Cook County Department of Public Health says there are no confirmed Ebola cases in the United States linked to these outbreaks, and other health officials stress the risk to people in Illinois and across the country remains low. Ebola outbreaks are being monitored in remote areas of the Democratic Republic of Congo and Uganda, but local and federal health officials say the situation overseas does not mean you're at risk here at home. We've also learned Rush University Medical Center and Lurie Children's Hospital are designed elite special pathogen treatment centers, meaning they have enhanced training, equipment, and protocols to safely evaluate and treat patients with high-risk infections like Ebola if a case is ever identified here.
There's very few hospitals in the US that are able to do that. It would be highly unlikely that somebody in the United States would be exposed to Ebola virus disease. But if someone has, in fact, traveled to the Democratic Republic of Congo, Uganda, or the Sudan in the last 21 days, it's possible that they've been exposed to Ebola virus.
The CDC is taking extra precautions against Ebola, including airport screenings, travel monitoring, contact tracing, and increased hospital preparation. Health officials emphasize Ebola is not spread through casual contact, and unless someone has recently traveled overseas or has direct connection to the outbreak, there's no reason for them to worry right now. Lizzie?